I'm Tracy Rosa. We are at the Lakewood Ranch Medical Center, where we have an incredible opportunity to come inside of the operating room and really discuss how they are improving and expanding their robotic surgery program. Joining me now is Dr. Yelverton. He's going to talk about what is robotic surgery, what kind of surgeries they can do, how they are expanding and getting new equipment in here, and why this makes a difference to all the people living in our community. Dr. Yelverton, thank you so much for joining me today. Who can get robotic surgery? What type of surgeries are we talking about?
So here at Lakewood Ranch, we offer a wide variety of robotic surgeries, from elective cancer surgeries, acute care surgeries such as gallbladders, appendixes, bowel obstructions. We do bariatric surgery here, reflux surgery, hernia surgery. So pretty much anything inside the abdomen we can do minimally invasive with the robot.
And why are robots different? What does it mean for the patient themselves?
Yeah, so for robotic surgery and the patients, and as well as the surgeon, for the patients it helps decrease blood loss, decrease tissue trauma. You're able to do more with the robot because it has wristed instruments. You also get an extra hand as a surgeon, so instead of operating traditionally with open, you only get your two hands, or if you have an assistant, the robot, you get a camera that you control with 3D vision. You get extra arms that can get in tight corners that are very hard to get to with traditional surgery.
And that translates into quicker recovery, better results, all those different things. Very exciting news. You're adding an additional robot to the facility here, which means what for the community?
So for the community, we get another robot which gives access to more acute care surgery, after-hour surgery, on top of expanding our elective cases that can be done here. So for the community, it's a great win. It offers more availability.
All right. Well, I love all the talking, but I want to see the action. Do you mind showing me how this works?
Yeah, let's go. Let's take a look.
Great. Go ahead. So we're getting ready to perform a robotic surgery. You are over here. The patient is over there. One of the big misconceptions is that people think that the machine is doing all the work. That is not the case. You are still doing all of the work. Show me what you're doing right here.
So right here is what we call the console. And my hands go in these little finger instruments and allow me to control all of the instruments on the robot.
And that is allowing you to do what? More precision, more smaller? Tell me about that.
Yeah, so we can do more precise surgery that leads to less blood loss and pain, like you talked about earlier, but allows us to do minimally invasive surgery at a higher level, as you can see with the instrument manipulation, and all around a better experience.
All right, go ahead. Show me what you're doing there. You cutting, stitching, all the above?
Yeah, so we've already cut a little incision, you can see right here, and these instruments, are millimeters in size. So it just gives us, as you can see, I can move my wrists better, and as a surgeon, it just gives you better control of what you want to do. So anytime you're, suturing or doing any type of surgery, it just makes it much easier on the surgeon, which makes it easier on the patient afterwards. So
does it speed up the surgery process too? Is this a faster way of doing a surgery?
Yeah, in my opinion, once you get good at using it, it makes it much quicker, in my opinion. But you can see you get 3D vision. Things are more natural rather than traditional surgery.
I'm not going to say don't have a steady hand, doctor, but I'm looking at this and I'm just shocked at how precise it is and how steady it is and how it seems just to be stitching that up perfectly right there.
Yeah, it does all of those things. It can actually get rid of tremors. And like I said, just allows for finer manipulation of tissue, which leads to less post-operative pain, and as well as just a quicker recovery. And that's it.
I'm impressed. Very impressive. Thank you so much for showing this. I don't think that people really, you hear robotic surgery, but to see it is so impressive. Real quickly, what does this mean for our community to be able to add one more robotic machine here at Lakewood Ranch Medical Center?
Yeah, I think it's a big win for our community. It just means more access to minimally invasive surgery.
Well said. Thank you again. I appreciate it. If you would like more information, we encourage you to go to LakewoodRanchMedicalCenter.com, and we will be right back.